Indonesia has cleared 2 suspected cases of Ebola. Both patients apparently tested negative for the deadly virus. Officials are keeping them quarantined for the next 21 days in case they develop signs of infection. Indonesian airports have set up screenings for arriving travelers and a designated hospital, just in case they need to receive possible cases. Joining us for more on the Ebola epidemic is Dr. Yangzhong Huang. He's a senior fellow for global health at the Council on Foreign Relations. Also, he's a professor at Seton Hall University. Professor, thank you for joining us.
Thank you, ASEA.
So how prepared is the continent of Asia on a whole to deal with Ebola in case there's an outbreak?
Well, so far that most of the Asian countries have realized that there's a risk of potential spread of Ebola to their countries. So they have upgraded the precautions. They have also instituted the airport temperature screening. So this is the preparation they have done so far.
Are you surprised that we haven't seen a confirmed case of Ebola in places like India or the Philippines?
No, I'm not. Actually, if you look at India, India is, in terms of the trade and travel, India is the 13th, I believe, the destination for the flights leaving from Western Africa. And I think despite the risks, that we should not overstate it, the risks posed to the Asian countries. First of all, that we know that the Western Africa, that especially in Liberia, that Ebola outbreak is bottoming out. Actually, the number of cases has plummeted. And secondly, most of the Asian countries, after experiencing H5N1 and other outbreaks, they have been experienced in handling the disease outbreaks. So I think that will put them in a good position to handle the Ebola outbreak.
Dr. Huang, China, of course, had dealt with SARS a few years ago, which was an airborne deadly disease, far more severe than Ebola. What are some of the lessons the international community can learn from China in how it handled SARS?
Well, if you compare SARS with Ebola, certainly they have differences. First of all, that Ebola is not as contagious as SARS, even though that it has a high mortality rate than SARS. But given that the asymptomatic people are not going to shed this Ebola virus, so that makes it the quarantine strategy more likely going to succeed. In that sense, China's experience in fighting SARS also helped them to prepare for the potential Ebola outbreak.
We talked about the Philippines and India. What about places, perhaps more progressive places like Malaysia, South Korea, and Japan? Do you think those countries are perhaps better prepared?
Well, they have countries certainly vary in terms of their health system capacities and their preparation. But I think most of the countries have realized the risk and the problems, and also if you look at their trade and travel links, it's naturally the Western Africa is not that much a major trading partner to some of these countries. So and if you given that many so far no Asian countries have any publicly confirmed Ebola cases, and there are only several suspected cases, and given that the plateau of the Ebola cases in Western Africa, I think the risks has been not as serious as compared to 10 or 20 days ago.
And Dr. Huang, Singapore is now requiring visas for everyone coming from West Africa to Singapore. Do you think these types of measures are constructive? Will they stop the spread of Ebola?
Well, the past experience suggested that airport screening is a approach, a potential that could reduce the spread of the disease such as Ebola in terms of imported cases. but it's not going to be the silver bullet. In fact, my research suggests that in China, in terms of handling the H1N1 cases, that only 1/3 of the cases actually were found through border screening process. So it is, I think, important to have the quarantine approach, but in the meantime, I think it's equally important to adopt a risk-based strategy in handling the outbreak. By that, I mean we should differentiate the cases in terms of who have direct contact with those patients that already show the symptoms and those who haven't showed the symptoms. And based on that, different approaches should be adopted.
All right. Thank you so much, Dr. Yangzhong Huang. Thank you.